Well, thank you very much. Can you see my screen now?
I can see your screen.
Yeah, I'm very really happy to present here. I met Aaron Bacca at the Inventors Conference in Calgary, and I think we were both taking a little break and hiding from the network at the Bell Music Museum, and just had a fantastic conversation. And also talking to Jacqueline as well. I think what you guys are doing in Alaska is similar in a lot of ways to what we're doing in the Okanagan. So I live in British Columbia, Canada. We're in a very strange part of Canada where the weather's generally very nice. We have about 250 wineries within an hour of my house, lakes, we grow peaches and apples. So it's just a really wonderful place to live. We also have a very, very exciting and growing tech ecosystem. So 8 years ago, when I first got involved with the startup community in the Okanagan, they had a startup competition. They were trying to get 10 people to present. They couldn't get enough people, so I actually just made something up. Now it's a very sought after event where they'll have 50 to 60 applicants, and it's very, very difficult to get in. So community can change really in a short period of time. Yeah, I've titled this The Future is Now, and how to build a company with global impact. I'm going to touch on a bunch of different subjects not entirely related to my software company, but I will describe a little bit about us. So we're a different kind of software company. So myself, I've been a software engineer for 20 years. Early in my career, I worked on touchscreen voting systems for American elections. I worked for a company, we built military tactical simulators, mostly for Middle Eastern armies. We converted that to an emergency and disaster management simulator that the US Army used for chemical and nuclear training, pandemic flu simulator for the Center for Disease Control. They used that for training probably 2 or 3 times until the swine flu hit, and then they were busy doing instead of training. And then so my company went through various different phases. In the last 3.5 years, have really focused on growth. And so we've been able to acquire some really great clients, QH in the medical, QHR Technologies as a EMR company that recently got bought by Loblaws in Canada for tens of millions of dollars. In the non-medical space, we have Cal Tire. It's Canada's biggest, their biggest tire chains. We built a booking system that got rolled out into all of their stores across Canada. But most recently, and one that's a bit more relevant to Health Tie, is we want to contract with the Alberta government and the University of Calgary, and it's called the Impact Program. And what we're building for them is a platform to help life sciences companies that are developing medical devices, medical software, or drugs to get through the FDA, Health Canada, and EU health processes quicker. So we're managing their clinical trials, document storage, all the things that you need to plan your medical device. So like, medical devices, there's about 1,700 different pathways. So we're not defining all those pathways, but we're building a system so that will guide you through that. And then as other medical device companies start using the system, they don't have to start from scratch. And working with the Impact team, they're very familiar with all the different gotchas and things. As you know, in medical, if you have a mistake through the regulatory process, it can put you back months or even years. So we're very excited with that. And through that, we're able to be working at the University of Calgary. And it's called the Life Sciences Innovation Hub. So they have about 12 life sciences startups working in the same place. So it's a very, very exciting place to be. And for us, this was a very exciting project to win. It was even being able to bid on it was quite a big deal. So we've been working on that for several months. It's going very, very well. Through that, it's really focused as a company that we want to focus on health technology as a company, apply our skills that we've had in in energy and defense and all these other industries, and focus on health. I was watching a video recently, and they're kind of pegging health technology compared to other industries sort of stuck in about the year 2002. And for such an important thing that affects obviously literally everybody in the world, it's a place where technology can really be applied and sort of get out of the concept of sick care and really get into healthcare and predictive health. Actually, like a local company here in Kelowna, they're developing a device. It's a saliva-based insulin test, which is really exciting. I also have another company, and this is not software at all. So I was at CES in Vegas, and I met the manufacturer of these medication cooler bags. And there's two products. One, the little blue sponge that you see there, you soak it in water for about a minute, and it'll keep things like insulin and EpiPens at room temperature for 3 to 5 days, and reusable hundreds of times. And then there's a fridge temperature one that'll keep it at fridge temperature for 12, 24, or 36 hours. And, this is definitely out of my comfort zone, but I started doing the research, and in North America, there isn't really anything of this quality in North America. So it was kind of a no-brainer. And then I ended up with connections to some of the largest pharmacy chains through my software company. So we're trialing them out in drugstores in Western Canada right now. But one thing I really like about it's actually helped me learn more about health, particular medications, the difficulties that people have living their lives based on their illnesses. Spending a lot of time with Diabetes Canada. There's a big campaign by them. Spend $150 million on CGMs and pumps, and it'll probably save $20 billion in follow-on healthcare costs. So as an entrepreneur, I might spend $150 million, just do that right now. But unfortunately, government doesn't work that way. But it's just the learning I'm getting is really exciting. And I'll just touch on this really quick because it's kind of exciting. We're we have a device that will help kids on ski hills. Their parents know where they are, so if they get lost or hurt. Serious accidents. So we have some IoT experience as well. So, fairly broad company for the size we are, but everything has a purpose. It's all about helping people, and especially with the health, saving lives and living better lifestyles. And I wanted to touch a little bit on community as well. So I know you guys have a X Prize type competition coming up. And so I'm currently president of the Okanagan School of the Arts, which I'm not an artist. It's like, why are you doing that? So I actually moved my business into this building. And one of the reasons I did it, we had a competition in Canada called the Smart Cities Challenge, and it was a $10 million prize where communities had to come up with, I'm just going to jump ahead here. Communities had to come up with engage the community and find out what the community's biggest challenge was in one sentence, and then how to use open data and connected technology to solve those problems. So I saw this competition, and I crashed the city Christmas party and basically told them we're going to enter this competition, but we're going to run it as a very grassroots community initiative, because a lot of times government gets in the way and and things don't actually get done. So we actually gathered tons and tons of data over about 4 months. We had thousands of people engaged. We had this concept of this giant blue number 10 that we carried around to various locations across the city. We had probably 1,500 people took their picture with this number 10. But what it did is every time I walked into a place, someone said, "What is that number 10 for?" And immediately I said, "We're coming up with 10 projects to win $10 million for Penticton to solve our biggest challenge." And that just opened up conversations, and it allowed engagement from a broader section of the community, rather than, you end up with a bunch of committees and things, and nothing really ends up getting solved. And so we had politicians, like one of the prime minister candidates for Canada was here, the premier, MPs, MLAs. It was really exciting. I didn't really understand it when I was given the number 10, but it became really exciting. Actually have a giant Hollywood type sign that says Penticton, and we changed the O to an E for this competition. But it really showed me that the value of the community involvement in these things, and finding ways for engagement. So a prize is a really good way to do that, because it's exciting. It's something different. And so we came upon this statement: let's build a physically and mentally healthier, strongly connected Penticton, where each person has access and opportunity to maximize their health potential. And so what we found through this process is that we actually have a higher than average mental health issues in Penticton. And that's a beautiful place to live. But my theory is that in the summer, it's really difficult for especially seniors to do the things they want, because it is a tourist town and it gets really, really hot. So we get over 100 degrees often in the summer. But I can't prove that without data. So I found, there's a company out of Vancouver, and they're in the US now, and they're able to gather better than census level data down to 11 households in real time, practically. It sounds a little scary, but once you have that data, you can start to see migration habits of people and how are they behaving differently, not down to the person level, that you're not allowed to do that, but to see the difference is at kind of a macro level of what's happening in your community. Then you can start to make better informed decisions. And I also learned the value of intelligent community design. And so if you design your communities healthier, by default, your people end up being healthier. So coming back to the community, what we found is that there aren't enough community collection points in Penticton. And a lot of the organizations were fractured. So for me, being part of this arts organization is hugely impactful on health. And actually now, since I've taken over this, I've consolidated the other arts communities, and we're all communicating together, and how can we maximize the impact on our local community. And art and health there's very clear outcomes having arts related activities for people in your community. It's been a bit of a bigger challenge than I expected with this 100-year-old building, but it's like really exciting to be part of. And then a little bit on community as well. So I asked Kelowna how they created their tech industry, and they said it really just started with monthly meetups over beer. And so that's what I did in Penticton. And hearing what Jacqueline said about Alaska, it sounds very similar. And I didn't theme it. I didn't do anything. I just said it's going to be, well, I themed it to tech. And I said once a month, if you're interested in tech, related to tech, whatever, like tech, come out and have a beer. I had no expectations. At its peak, we had 40 to 50 people coming a month. We're a city the size of 35,000 and 450 members in the group now. So now we're going to try to expand this throughout the region. So really what it ends up being is people talking to each other and bumping into each other. And that's how things happen. And that's how communities get built and opening things up. So Kelowna is a bigger city, 130,000, and they have just a really thriving community. And that we have an accelerator who they do run programs for tech companies, but their primary focus really is just building that community. We actually just sponsored a Future of Health Cancer Forum where we had cancer specialists from all different areas actually in the same room talking about it and linking it to tech and how can tech help solve health problems. I'm just going to leave with this slide. It was in the email. So I'm not sure how many of you are familiar with Pavlos Holman, but he helped Jeff Bezos create Blue Origin. And he's really focused with Singularity University and what they're doing to help save the planet. They're really against, let's build the next big app and focusing on money. And so one thing he said really stuck with me is that let's stop focusing on being the next billionaire. Let's focus on something that impacts 1 billion people on the planet in a positive way. And so if we start looking at things with that lens, and health is the perfect area for that, there's so many incremental changes that we can make. We don't have to always do the big flashy thing, but start small and let's do something that actually has an impact on people and not just makes you money. Money ends up being a byproduct of it, but so I just have that in my mind almost every day. And I don't have a clock in front of me, but I think we're probably about there.
So we've got about 10 more minutes, okay. Keith. I'm blown away by everything that you've shared. Obviously I have a lot of questions, but I'd like to just take a moment and maybe ask you right now, what's the thing that you're most proud of right now that you've been able to build?
I'm really proud of what the Smart Cities Challenge was and just how that brought the community together. And even though we didn't win the $10 million prize, the impact that has had on our region. And so our local university now is running an initiative. They're going to create a Smart City sandbox, and I'm able to hold them accountable and say, let's not just think about your city, let's think about the valley as a whole, and to kind of change the thinking to a solution-based thinking rather than a problem-based thinking. So I'm very proud of that. I'm also very proud of the team we've been able to attract. So because of our work with Impact and things we've done in the past, I've just hired a CTO, and his wife is a former IT professional turned physician. So now that she's in the healthcare industry, she's extraordinarily frustrated. The EMRs are terrible. The system is so difficult. She's, spending so much time charting, and she's Canadian system is a little bit different than the American system, but she gets 12 to 15 minutes to talk to a patient. So she's trying to make money while also trying to provide care, and it's very difficult. And yeah, our director of software recently, he was leading a team with a company called Zephyr Sleep Technology. So he's leading a medical device right through the regulatory process. So for me, being able to attract that kind of talent, that's not just, wanting to write tech, but part of the vision and part of changing the world. Very, very proud of that.
Okay, awesome. Well, I'm going to open it up right now and see if there's anybody online who would like to ask a question.
I always try to unmute my photo instead of, the actual icon. So when you were doing the meetups, how did you, what techniques did you use to get people to come to these meetups? I love the idea of the casual over a beer.
Yeah, so I use meetup.com, which a fairly popular tool, but it's more than that. So the initial event, I really made sure that I had engagement from the city and got some sponsorship, but really made sure to let them know they're not guiding it, that it is really a community initiative. And in tech and really any networking opportunity, I focused on the new members, especially tech. They're, I'm a software engineer, I'm allowed to say it, but we're nerds and we're generally not very good with talking to other people. So I really focused on seeing who was new, and when they came in, making them feel welcome and introduce them to people that are there. I also, I remember, I think the second or third, they had all this row of tables set up, and everybody ended up sitting at this table, and people only talked to the 4 people around them, and it was actually a very dysfunctional event. So that from that point on, I made sure no tables allowed. Some tables so people could eat, but to make sure that it was standing up and mingling, and really curating that feel and making sure that everybody felt value of coming there. So it was really strong for about 2 years, and then it sort of slowed down. I think it just sort of hit its point of usefulness at that point. But starting simple, I think, was really great. We had tried to do something previously, and there was a speaker every time, but when it ended up happening, if somebody wasn't interested in the speaker, they didn't come. And then the speaker ended up being half an hour, and really what people were there for is networking. And I think now we're at the point where we would be more effective having some topics and speakers, because we have that momentum. And it depends on the region, right? Like Kelowna, you couldn't just do something casual. It has to be focused, and it just depends on your region and where you're at.
So I think I saw Eric had a question. Eric, did you want to ask something?
Yeah, hi Keith. Yeah, I was, I don't know if it's that or a comment, but your Smart Cities Challenge and your statement there about physically, mentally healthier. Boy, that's whatever issues you have there in your healthcare system, we've got them here too. And
yeah, actually, sorry, before you finish there, one of my employees, her husband's a professional road biker.
oh,
He got hit by a car in Arizona. And so they're very, very much embedded in the American healthcare system. They had insurance, so he was getting really, really great care. But yeah, it's challenging everywhere.
It's challenging, and here in Alaska, we're a long ways from the base of a lot of the schooling for professionals, and so to get them to come here, and it's a harsh place to live long term, and so the initiative of bringing folks together and looking creatively at how to overcome some of those barriers, and that's where we're at here. My organization's really looking at statewide, but here in Anchorage, of how do we build some infrastructure in the healthcare industry to meet people that are in these crisis stages, and specifically on the mental health side of things.
Yes.
Now, across Alaska, if you're having a mental health crisis, your options are the emergency room or jail or the street. And that's basically it. We have nothing in between. And so, getting me thinking just in terms of, juices with Health Tie and our, try creatively, because we know there's work out there, but you're right. The infrastructure of the bureaucracy of the healthcare system in the state, it's a slow process.
Yeah, and I think a lot of it really does come down to communication. And I like to hear about the mental health aspects. I actually have a Pechakucha presentation where I talk about mental health and entrepreneurship. I've had some pretty significant challenges in my life, and I actually see this across all different community things. Is everybody sort of ends up being sort of siloed in what they're doing. So my mom's a retired pharmacist, and she knows way more about drugs and interactions, and in a lot of cases more about the patients than the doctor does, because she has more interaction with them. But then doctors like, oh well, no, I'm the doctor, so therefore I know best. And really, there needs to be a bit more collaboration. And there's I'm sure you have something similar. We're just getting started in BC with primary care networks, so trying to get that cross collaboration between the different things and looking at health as a holistic overall thing, rather than just going to the doctor, getting an appointment, and getting a drug.
Jacqueline, you're muted. Jacqueline, you're muted.
Absolutely. So one of the things that I think we'd like to do is maybe model some of your healthcare rather than sick care. So addressing preventative aspects. I mean, using some of the digital devices that you were talking about might be a way to do that, is kind of getting people to be more aware of some of their healthcare concerns that they should be monitoring. We only have a couple of more minutes, Keith, and we can always invite you back another time. You clearly have more that we could learn from, but I asked you to, prior when we're talking just to get ready, why should entrepreneurs and people in software be interested in trying to solve some of the healthcare challenges? Like what do you think their interest is, and what's the opportunity?
Well, I think there's huge opportunity with data. There's so much data. If we start collaborating better, figuring out how to safely share people's data, and there's so many problems that have been solved in technology, even just workflow and how communication happens that don't happen. Like we forget sometimes in technology. Like we communicate so well over so many different tools. Like I don't know if you've heard of the tool Slack, but we're doing that for our nonprofits, and we can have guided or subject discussions around with people with our nonprofit organizations in Penticton, so we don't have to have emails anymore. And it's categorizing the information, right? And we're in information overload. Like I can't even manage email anymore. Like because everything's coming to one email address, and I just don't know where anything is anymore. So finding different ways of communicating and collaborating, and just getting lessons learned. Not that we do everything right in tech. We do a lot of things very, very wrong. And I kind of look at when I was at the Cancer Future of Health Forum, I said this, and I think in a lot of ways, a lot of problems have already been solved. They've just been solved in a different area or a different industry. So we went to another conference in Alberta with Genome Alberta, and really struck out that even with research, there's not a lot of communication and collaboration. So again, I'm not that familiar with this, but it really struck out that there's not a central place where everything's kind of easy to get to and collaborative and sharing. It's sort of this institution has their area of research, and they're very, very closed. So the more sharing and openness with data and cross industry is so important. With Singularity University, there's a website called abundance.digital, and it's about $1,000 a year to join it, but you just get an incredible amount of content. So I'm watching a series of videos on the concept of health and technology, and right there's 100 ideas that 100 businesses could be started to help people.
Awesome. What a wonderful way to end our presentation, Keith. Thank you so much. I mean, essentially what you've just voiced is the role that HealthTie is trying to fill. So that collaborative communication, that hub role that would bring these different silos together. So thank you very much. That was an excellent presentation. And thank you. Well, community, thank you very much for participating today. I know that as usual, it went way too fast, but I encourage you all to share your ideas with me. I, of course, can connect you to Keith at Big Bear Software, and you could probably even reach out and find him on your own, but I'd be happy to connect you. Keith, please stay engaged. We really want to model some of what you've been doing in Penticton and Kelowna here in Anchorage.
Mm-hmm.
And
yeah, absolutely.
All right. Well, thank you everyone for participating. I want to tell you that on February 13th, we'll have our next Open Innovation Thursday presentation. That is going to be Anwar Mohammed Sadat, who came to Anchorage actually to present to our computer technology program at UAA. And so he'll be back in Pakistan, but will get up in the middle of the night to present to us and tell us more about his artificial intelligence research that he's been doing, and hopefully connect to us through some of the medical work that he's trying to do in Pakistan. So thank you all for participating, and I'll see you soon. So